Hi, my name is Gina Libby, and I am an advocate, action network leader with the American Pain Foundation, and we are an awesome organization that serves to raise awareness about the undertreatment of pain in America, which is a huge problem. And I serve in this position because I am a person who has experienced a lot of pain in my life. I don't really like to, I'm going to try and be really honest here, and I really don't like to go into the story about it because I feel like living with untreated pain for a long time changes your internal system. It absolutely does. And for me, as I think back of my story, if I think back of the years that I didn't get care, or the years that I suffered with a disability and just was angry and irritated and didn't really know what was going on. I've come a long way since then. By getting treatment. I've used a lot of different therapies and such, but I realize now that when I tell my story, when I talk about things in the past even, I feel pain. And so this is a kind of a precarious situation to be in, because I know this about myself, and yet I want to serve, and I want to help people, and I want to be able to share my story. But when I relive that story or think about that story, which is basically years living with pain with no help, and I've got scoliosis and I had corrective surgery when I was 20 years old, so I have 2 rods in my back and a long spinal fusion, scar from neck to tailbone. I mean, I'm an obvious case of someone who would be experiencing pain, and for many years when I went to the doctor, I just was ignored. And I know that so many more people are ignored because they have conditions that are invisible. And mine was about as obvious as it gets, and I was ignored. So what I'm trying to share here is that the changes that occur when a person lives with pain are just full of loss. And there's definite physiological effects. And I'm really aware of those, which is why I try and reduce my stress level a great deal and keep my attitude positive and work on cognitive behavioral therapies and such, because as I experience things that are upsetting or stress and stuff, it plays out in my body as physical pain. I want to share a little story from something that happened within the last couple months to me that I think explains or really demonstrates the severity of pain. And that is, I had a spinal decompression procedure several months ago to shave off some bone that was laying on the sciatic nerve. And after that procedure, I had some complications. Some blood got on the nerve and on my nerves, and I wound up with 2 legs that were neurologically impaired, and I couldn't walk. So that was in August earlier of this year. Now, an amazing thing happened. While this trauma was occurring, I had absolutely no pain. Absolutely no pain. So I was in a recuperative unit, and I was learning to walk again, and I was using a walker and then crutches and canes and this kind of thing. I eventually wound up with walking sticks. But as I was coming back, and like I was saying, I had no pain, absolutely none. It was like my body could only deal with a neuro impairment, and so I just wasn't having any pain. I've subsequently come back from that, and I'm a fully walking, functional person now. I don't have any impairment in my legs, which I'm very thankful about. There is some nerve pain that's returning, but the point of this story is really, I never would have imagined this, but life on a walker, not being able to walk, but without pain, was less disabling than being a totally active-looking person with legs that function and a body that functions, living with a lot of pain. Pain to me is worse than being disabled. The two don't necessarily go together. That was really a strong realization about the impact. And many people haven't put that together yet.